Okay, prior to the beginning of this vignette, I carefully and thoroughly completed an informed consent conversation with my client, and the client consented for treatment. I also carefully and thoroughly reviewed all confidentiality policies with the client and appropriate authorizations of release of information, and have been signed by the client. There we go. Hi, Donna. I'm Sharon. Thanks for having me over.
Thank you for coming.
You have a lovely home.
Thank you.
I was sent here by your physician from Woodward Hills, where you were rehabilitating from your hip replacement, to help acclimate you back into living at home. It's been a while that you were at Woodward Hills.
Yes.
So
yes,
different than living at home, isn't it?
Yes, it was like 10 days, plus I think it was 3 or 4 days in the hospital.
Oh my! So hospital first, then rehab, and now you're back home.
Yes, I am.
Well, that's wonderful. Well, I'm a visiting social worker, and I visit people like you have had some time out of home and had a significant surgery or event, which a hip replacement is, I would assume. And so I'm here to visit with you, help you reacclimate, be of any use to you that I can. Your first trip back to the grocery store, I can go with you. We can go to the library, things of your interests. So that way you are just going seemingly back in, but you're not just on your own walking on your new hip.
Right.
You have a partner to go with you.
Yes, I understand. It's great.
And I'll give you my number so you can call me on a daily basis if you want. I might not be able to answer, but leave me a message and I'll get back with you. So we can talk about things that happen. But at my agency, that's what we do.
Okay.
Do you have any questions?
Not at the moment.
Okay.
I thought we'd get into it a little bit.
Well, how are you feeling about being back home?
I'm comfortable. I got comfortable at the nursing home too, but I'm much better off at home.
Yeah. So you did have some a level distress anyway at the nursing home. So you were comfortable there.
Oh yes.
Okay.
Oh yes. It was good.
And the therapy? How did you like the physical therapy?
Therapy was wonderful. I had the most wonderful woman, and she went above and beyond the usual exercises that they give for the leg after a hip operation, and she massaged my thigh, which was hurting. There was a band right from my thigh down to my knee that was hurting, and she massaged it, and she was wonderful.
Oh, that was nice.
Yes, I was really pleased.
Is there any way you can go back every other week or a month or so? Is this the kind of place you can do that?
No.
Oh.
No. They only give therapy to people who are staying there.
Oh, so you really enjoyed that.
I did.
You're going to miss that.
Yes, I am.
No,
yes, I am.
It was nice to be pampered, though, and taken care of.
Oh, absolutely. Absolutely. It's wonderful.
Especially after something like a hip replacement.
Right.
I mean, that's a pretty significant part of your body.
Yes.
You weren't going to a spa. You were going to rehabilitation. But it sounds like they made you feel good there.
They did. And I walked quite a bit. I was on a walker. And I walked around the whole facility.
Aww.
And everybody knew me because hi, Donna, because I was always walking all over. And they have these white stockings that they want you to put on. And my sister came and she said, you should have those white stockings on. And I asked the nurse, and she said, you don't need them. She said, it's only for people who are lying in bed. And he said,
Sisters.
It was, I know, it was a male nurse, Ed. And he said, you don't need the stockings because you're walking around enough, keeping the blood vessels free.
So you had your sister visiting.
Oh, yes.
Friends that come along?
Yes, my son and my niece came over to visit, and and my girlfriend from I've known her for 100 years. She works during the day, so she came like in the evening. And in fact, she was there one time when my son was there, and she was really very, very helpful. And one time she came when I was having therapy, and she was sitting on the head of the bed. There was a big bed I was lying on, the therapist was rubbing my leg, and it was still pretty sore.
Mm.
And Carol was sitting on the head of the bed talking to me, and Sue said, the therapist said, I don't know what you're talking about, but just keep talking because I'm getting away with murder down here. Because she was really rubbing my leg and I wasn't
really working,
moaning and complaining.
Well, I must say, when I walked up and saw you through the window walking towards the door, it's not what I usually see when I see somebody after a hip replacement. Mm-hmm. You're getting around quite well. How do you feel?
I feel fine. I feel good. My hip is healing nicely. Mm-hmm. The only thing that bothers me is that I had if you don't mind my saying so, bring this in, I'd had a knee operation, mm-hmm. and that didn't quite heal properly, so I was limping a little bit. But with this therapy on my hip and walking around the nursing home, it helped both my hip and my knee. So I'm feeling okay.
That's a good thing.
Yeah.
Now, that's quite a bit of intense attention and the walking around, and you got to see a lot of different things, but now mm-hmm. you live in the country.
Oh.
How's that transition where you do maybe see birds?
Yes, right.
Birds, they don't wave back.
And they don't wave back, no. But it's very comforting here. The trees are gorgeous, and they make you feel cozy. Okay. And my house is comfortable.
So you don't think going from that nice attention to quiet is like falling off the cliff?
Oh no, because I actually prefer being alone, and I didn't really associate with the other patients there, not because I just was happy with what I had.
Oh, sure you did.
I read books. They had a wonderful library, and I read 7 books while I was there.
Oh my goodness! In 10 days.
Yes, I did.
In 10 days.
Yes.
Well, so you have at least one, but I'm sure many more long-term friends who came to see you. You have a good family structure, so
yes.
You were polite, but you didn't need to go socialize and play bingo in it.
Exactly. Yeah, they had a room and the girl would come around and she'd say, well, we're going to have bingo this afternoon or something else, and I'd say, pass.
Oh. Well, then you read 7 books.
Yes.
Now, what was, how long were you in pain before the surgery?
Actually, I wasn't in pain. What happened was just that the cartilage was slowly disintegrating. Okay. But it was not, it was almost, well, it was pretty much bone on bone, but I didn't have pain. It's just that I don't remember why now.
Did you have a decrease in any activity prior to this, or you could drive and go to the store maybe?
Oh yes, I was fine.
Now, since this was your right hip, mm-hmm. when did the doctor say you're cleared for driving?
Oh, well, he kind of left it up to me, but he said at least for 2 or 3 weeks after I get home, because it's my right leg.
Okay.
And my left, I think I drove after maybe 10 days or 2 weeks.
Okay. Well, it seems like you reacclimated home quite nicely, and you're not missing it. The attention too much.
No, I'm okay.
So, maybe a goal would be to get back in your car and get going.
Absolutely.
The places you like to go.
And go to the library and they have these wonderful little carts in the library where you can hang on to the cart, and they have a little basket in front, so you can put your books in it as you're walking around the library.
And as much as you read, you'll need it.
Yes.
Now, anything else you're looking forward to doing now that you have a brand new hip?
Well, I never have been athletic, so that's not what I'm looking forward to. I'm just looking forward to walking straight, not limping, and not hurting.
Oh, good. Well, that's it, and it seems like I said, when I saw you walk through the door,
mm-hmm.
past the window when you get to the door, you were doing quite well.
Mm-hmm.
So, Would you like me to come over on your first trip out to the store or to the library? Go to the library together. I go to the library. I live in town. I go to the library quite often.
Oh, yes.
Would you like me to? Would you like company on the ride over? So
I would. Just, is that okay?
It is. I was just throwing that out there just in case, because sometimes after a big surgery like that, some people feel, a little nervous behind the wheel, or just want to cruise around the neighborhood first. But if you'd like some company, I go to the library myself.
I would like that at least the first time I go, and then maybe the first time I go to the grocery store,
which would be
to kind of help me get the bags in and out.
Sure,
and whatever,
and just to test your stamina.
Yes.
And your confidence with.
Yes. I think I'm confident in driving because I've been driving for years and years and years, and so I'm not worried about driving.
Right.
I just want to make sure that hip is strong enough to hit the brakes when I need to.
We'll test it in the driveway first.
Oh, yes, okay. I agree.
Oh, good. Well, thank you, Donna. It was nice to meet you.
Thank you.
And I'll give you a call before I come over.
Okay, fine. I appreciate that.
Bye-bye.
Bye-bye.